been waiting for a long time to actually break out like this so that I could show you what to do about it. In particular, when it first shows up, whether you see it or whether you feel it. A lot of times you feel it before you see it, and it sometimes hurts. So what we're going to do is do something that's called ice therapy, which was developed by Dr. James Fulton, who is a pioneer in acne clearing, who unfortunately passed away some time ago. And so I'm going to show you your supplies first. First we have your trusty ice. And you can either use the corner of an ice cube, or you can use a Dixie cup that you fill all the way with water, put it in the freezer, and the freezing will expand it to just above the lip of the cup so that you can actually use it if you have larger breakouts, especially if you have them on a regular basis. This is actually something that you need to do once or twice a day. For a good minute or two, what you do is you basically touch it very, very lightly, gently, to the blemish or blemishes, the entire area of breakouts, wherever you have them. But if you just have one or two, you just basically touch it very lightly to the blemish itself. Do not hold it there. Very important. You will burn yourself. So what you want to do is very, very gently massage it for about 1 or 2 minutes. And then, when you're done with that, very, very lightly dry off. And then you want to take a salicylic acid gel, preferably one that has soothing botanicals and pore purifiers such as this one, Daniela's Rescue Gel. A very, very, very small amount, not a whole lot. And very lightly dab it, massaging it in. You want so little because you don't really need a lot because you're putting it basically on one area. Now this is also something that you can apply on entire breakout areas, not only as spot treatment but also as preventative measure, depending on the types of breakouts you have. And you can actually go to my website and fill out my eval by email online skincare consultation form in order to get a better analysis on exactly what type of acne you have, what the cause might be, what's the best way to deal with it. So after that is massaged in a little bit, it's not really going to absorb very much. So this is also another reason that you don't want a whole lot, because the fact that you want to be able to put something else on top of it, such as a clay that has preferably zinc, sulfur. This one is a zinc and sulfur mask. And other masks are available that actually do a very good job as well. You don't want it to be too strong, like straight bentonite clay or that straight Aztec clay that you mix with water or apple cider vinegar and such. Those things can really be quite strong. It can actually make things a little bit worse because you can end up with greater amount of inflammation, which is what is involved in these undergrounders. So we're going to take a Q-tip like this, just a little bit, and we're going to dab it right on top like this and just leave it. You don't really have to rinse it off after a particular amount of time. Of course, you don't want to go to work like this. But you can just let it dry. And you can either rinse it off after 10 minutes or so if you need to, or you can just basically leave it. Eventually it will dry and will fall off. Normally, you would not actually do that. Normally, when you have a mask on your entire face, in order to give yourself the required weekly facial at home, either twice weekly or weekly, depending on your instructions, your individual instructions, you would not necessarily let it dry. Clay works while it's drying and not once it's dry. Once it's dry, it stops working and also can start irritating, depending on the formulation. But something like this, it's very important that you don't let it dry on your entire face and you rinse it off after 10 minutes. If it dries in less than 10 minutes, it means you didn't put enough on. So, ice, salicylic acid gel, clay, 10 minutes or more, every morning and every night until it goes away. If it does not go away after a few days of doing this, it means there is probably a core inside, meaning that there is a blackhead that has developed into a larger impaction, and it is continually irritating the pore. Obviously, also, if you have pore clogging ingredients in your makeup, your skincare, your hand sanitizers, don't forget, this is why this happened. A little bit too much of that while I was at the computer doing an eval. So, please contact me with any kind of questions whatsoever and fill out an evaluation form in order to get your individual analysis done. And sorry, I have a little bit of a cough. It's winter, disgusting. Anyway, so see you soon.